It's really wonderful to see everybody back here at London PCR. It's just amazing to have people back face to face again. I mean, you can't really underestimate the importance of seeing people and interacting on a personal level rather than on a virtual level, which does work to some degree, but you know, it's just wonderful, just joyful to be back. Transcatheter mitral valve implantation is part of the toolbox that we use in the non-surgical percutaneous approach to treating mitral valve disease. It's one aspect of this because we've got mitral valve repair and we've got mitral valve replacement or implantation. So really, there's a spectrum of mitral valve disease, and we need lots of different potential options to treat patients depending on their clinical status, their body habitus, and their anatomical mitral valve pathology. So it's one of the aspects. At the moment, we've got some really good outcomes results published on the transapical procedures for transcatheter mitral valve implantation. We have 2 years published from the early feasibility study for the Tendyne transcatheter implantation, which show very good clinical outcomes and also really very good, excellent durability of the Tendyne device. And we also have 6-year follow-up from the first patients that underwent Tendyne transcatheter mitral valve implantation from the Brompton Hospital, showing that of that cohort, that very early cohort of 5 patients, we've got still 3 patients alive almost 7 years after the device implantation, but also really excellent durability of the device. The choice is the choice of the optimal transcatheter mitral valve therapy for patients with mitral insufficiency. And this was an investigator-initiated registry, multinational, international centre, looking at 26 different centres, up to 767 patients who had at least moderate mitral regurgitation that were screened for potential transcatheter mitral valve intervention because they were either too high a risk or deemed to be prohibitively high risk for surgery, or had anatomical features of their mitral valve disease that made them less suitable for transcatheter edge-to-edge repair. At 30-day outcomes, we were looking at the peri-procedural success rates, and according to MVARC criteria, the procedure was with a range of transcatheter mitral valve implantation devices was good. There was an over 95% success rate with a very low peri-procedural mortality of about 1.8%. The 30-day mortality was a little bit higher, 9.9%, and that was predominantly driven by patients who had mitral annular calcification with access issues with bleeding. So that was predominantly in that group. Really, one of the key messages then is that at 30 days there was elimination of mitral regurgitation in about 84% of patients. And then at 1 year that was still high at 73%. So really one of the key features of transcatheter mitral valve implantations with a number of transapical or transfemoral devices is reproducible and reliable elimination of mitral regurgitation. And on top of that, there was a composite endpoint of death and hospitalisation, and in this really high-risk group of patients that are not suitable for surgery and very high abnormal mitral valve abnormalities for transcatheter edge-to-edge, there was a 39% a risk of reaching the composite endpoint of death and hospitalisation. So a little bit higher, but again, it was the same in a lot of the other groups. One of the big selling points of this registry is that it's not industry sponsored, it's real world, and it's looking at not one particular device but across the board. So this is real life, real world registry, and actually it shows that if you in patients that are very high risk, where you've not got very many options, edge to edge is not really very suitable, high risk for surgery, that actually if you can get the procedure done and you do have very good 30-day outcomes, then actually the elimination of mitral regurgitation that is predictable goes hand in hand with a good clinical result. We need to follow the patients that we have studied with transcatheter mitral valve implantation, but also what we want to do is to compare that group with the rest of the people that were screened in this study, because a third of the patients screen passed and underwent TMVI, but 2/3 of the patients screen failed, and we want to know what happens to them. A poor proportion of them undergo transcatheter edge-to-edge repair, even though the anatomy is suboptimal, and a smaller proportion of them undergo surgery. So we want to see what happens to that group and compare it to the patients that did eventually undergo transcatheter mitral valve implantation.